infection control. So infection, so some terms for you. So infection, it's an invasion and growth of microorganisms in the human body that can cause disease. Resident flora are found all over the surface of the body. When they cause an infection, they are referred to as an opportunistic microorganism. So we actually have, bacteria that live on us all the time. And they usually don't do anything, but sometimes they can, and that's what is referred to as an opportunistic microorganism. Pathogens are infectious organisms, and new pathogens will likely continue to emerge in the future. So I'm sure most of you have heard of COVID-19. That was a new one. There has been COVID around for a long time, but COVID-19 was a different strain. So things like that, happen all the time. Infectious agents are found in the hospital even, and are often more virulent and more resistant to treatment than organisms that are found, just regularly out in the community. So these are actually called healthcare associated infections, or HAIs, and they can also be called nosocomial infections. So an infected person is more likely to be admitted for treatment if they have a hospital associated infection. Hospital patients have a lowered resistance to infection by potential pathogens, and treatment with antibiotics may not have the best effect because some of these organisms actually have become resistant to these antibiotics. So contact with blood-borne pathogens. So this can be anywhere from a percutaneous injury from like a needle stick or a skin puncture. It can also be from contact of mucous membranes, like your eyes, nose, mouth, and this would be from a splash or from touching. So you get something on your gloves and now you rubbed your eyes and now you potentially have, a bloodborne pathogen. Contact of intact, non-intact skin via splashes or contact, a human bite, and contact with equipment or laboratory instruments that are contaminated with body fluid. So bloodborne pathogens are infectious agents that are carried in the blood, certain body fluids, and certain tissues. And that is the OSHA definition of the bloodborne pathogen. Phlebotomists can also come into contact due to droplet transmission. So depending on the patient in the hospital room, they could have a sign on their door that says droplet precautions, and that would mean that you need to wear additional PPE to protect yourself. So viral survival. Bloodborne viruses survive much longer outside the body than once believed, than once we thought. Prolonged survival, so be aware of sources of infection in your environment. Laboratory equipment that uses human blood or body fluid should be handled with appropriate precautions, and that's because viruses can live on surfaces for a few days. So if it's not cleaned appropriately or something like that, you have that potential to be exposed. So make sure you learn the procedures in your laboratory to help minimize those risks. And that includes equipment-related precautions, work practice controls, and spill cleanup procedures. Hepatitis B can actually survive in dried blood for up to 1 week. Hepatitis C can actually survive in dried blood up to 3 weeks. So make sure you are routinely disinfecting your phlebotomy tray with a 10% bleach solution to help minimize those contacts. The chain of infection. So there are 3 primary elements. You have a reservoir, the mode of transmission, and then the susceptible host. Other links within this chain is the method of escape. So this is the means by which the infectious agent can leave the source, and the method of entry, which is the means that the infectious agent can enter the host, which then in turn results in infection. So means or modes of transmission. We will talk about each of these in the next couple of slides, but they can be spread by 5 different means. The first one is contact, either direct or indirect, droplet, airborne, common vehicle, or vector. Contact transmission. This is the most frequent and important transmission route for healthcare-associated infections. Direct contact involves the transfer of organisms from an infected person directly to the host by physical contact. So touching somebody, with a contaminated hand, touching a surface and then touching somebody, any of that type of situation would be an option for contact transmission. Indirect contact can involve contact between a susceptible host and a fomite. And a fomite will include medical instruments, needles, dressings, bed rails, phones, pencils, computer keyboards, and gloves. Droplet transmission. So droplets are particles that are generated from the source by coughing, sneezing, or talking. So if you think about when you sneeze, all those little, droplets come out of your mouth, right? So that's kind of what we're talking about here. Droplets can also occur from liquid splashes or aerosols that can be formed when you are uncapping blood tubes. So there are caps on the tubes. So sometimes you need to take precautions with that as well. Droplet transmission is usually for only a brief time and within a short distance of about 3 feet from the source, meaning that specialized ventilation or air filtering equipment is not needed to prevent transmission. So because droplet particles are bigger than 5 micrometers, they are propelled only a short distance before falling and coming to rest. So you may need to still wear a mask going into these patient rooms, but they don't need any additional, like I mentioned, air filters or anything like that in the patient room to get rid of these. Now, airborne transmission, on the other hand, involves droplet nuclei smaller than 5 micrometer or dust particles generated by sneezing, coughing, singing, or talking. Droplets can be transported long distances and can cause disease when inhaled. So these types of transmission, airborne, does require special ventilation and high efficiency particulate air or HEPA filters are needed in these patients' rooms to help prevent transmission. So these are the rooms where you will have a sign on the door for sure, and it's going to tell you, what PPE you need to wear to protect yourself. So common microorganisms that can spread by airborne transmission include the Mycobacterium tuberculosis, Rubiola virus, which causes measles, Varicella zoster virus, which causes chickenpox, and Aspergillus, which is actually a fungus, and anthrax. Common vehicle transmission involves a common source that can cause multiple cases of the disease. So an example of this would be contaminated food or water or medical devices that weren't cleaned appropriately. This would be a common vehicle transmission. And some examples of bacteria that can transmit via the common vehicle transmission is Salmonella and E. coli. Vector transmission, so organisms that carry infectious agents but are not harmed by them. Examples are going to be arthropods like ticks or mosquitoes and mites. So examples of the vector transmission can include Rocky Mountain spotted fever and Lyme disease from ticks. An example from mosquitoes would be malaria, and scabies can come from mites. So to break that chain of infection, ways to break that chain is practicing appropriate hand hygiene, using personal protective equipment, making sure that we isolate patients with infectious diseases, and then using standard precautions. So OSHA requires all facilities to have an exposure control plan that describes all of these elements for preventing spread of infection. Hand hygiene. This is the most important means of preventing the spread of infection and antibiotic-resistant microorganisms. So hand hygiene can include washing your hands with soap and water, but it can also include rubbing your hands with an alcohol-based like hand sanitizer. In some institutions, an alcohol-based agent may be preferred, but the Clinical Lab Standards Institute, or CLSI, guidelines indicate that it should not be used as a substitute for hand washing. So your facility will probably tell you the same, that hand washing is preferred, but you can use hand sanitizer in certain circumstances. So to perform hand hygiene, everyone knows how to wash their hands, right? But sometimes we aren't doing it well enough. So hand hygiene should be performed at certain times as well. So it needs to be performed before and after each patient, before and after putting on gloves, before performing any procedures, after removing PPE, and after touching contaminated equipment, before going on break and after returning from break, and then before you leave the lab for the day. So performing the appropriate hand hygiene can significantly reduce the likelihood of passing the potentially infectious agents to yourself or other people. Personal protective equipment that we would use, or PPE, consists of barriers and respirators used to protect the skin, mucous membranes, and clothing from contact with those infectious agents. PPE can also include fluid-resistant gowns, aprons, masks, respirators, face shields, goggles, shoe covers, and gloves. And the type of PPE that's needed is going to depend on what you're doing. So if you're working in a clinic setting, you'll probably have less PPE than if you were working in a hospital setting. It's really just going to depend on where you end up working and what you end up needing to wear. Putting on the personal protective equipment. There is a brief procedure in the textbook that kind of runs through this as well. But basically what you're going to do first is you're going to, once again, wash your hands before putting anything on. You're going to put your gown on and tie behind your back. You're going to put on your mask, respirator, goggles, or face shield, and then you're going to put on your gloves and make sure those gloves go over the cuffs of the gown, but down by your wrist. Removing the personal protective equipment. So the order of removal is important, and this is to help to avoid contamination of skin or clothing. So you're going to remove the gown and gloves, and then you're going to perform hand hygiene, remove the goggles or face shield, remove the mask or respirator, and then you're also going to want to make sure that you follow your facility's policy for disposal. Standard precautions. So these precautions were published by the CDC in 1996. So infection control measures that use barrier protection and work practice controls to prevent contact between skin or mucous membranes and blood or other bodily fluids and tissues from all persons. These are minimum level of precautions applied when coming into contact with patients. These include practicing hand hygiene, wearing gloves, wearing your fluid-resistant lab gown or lab coat, wearing the appropriate face protection if needed, making sure that you are disposing sharps properly and activating that safety device, and then also practicing respiratory hygiene and cough etiquette as well. So making sure you're not coughing into your hand and then touching a patient. You're going to want to cough into your elbow generally. Occupational Safety and Health Administration, or OSHA. They are a regulatory enforcement agency for employee health and safety, and OSHA actually has the authority over all industries, including hospitals and healthcare facilities. OSHA has a bloodborne standards pathogen standard, and the regulation that was approved back in 1992, and this was used to help protect healthcare workers from infection. The bloodborne pathogen rule was revised in 2001, and that was really just to help clarify issues related to sharp safety. Bloodborne pathogen standard, once again, so employers must have a written bloodborne pathogen exposure control plan. Employers must also provide PPE to the employees at no additional charge. So you will never be responsible for buying your own gloves, mask, anything like that while in the workplace. And employers must implement work practice and engineering controls as well. They also state that employers must provide immunization against hepatitis B free of charge to all healthcare workers. Employers must provide free medical follow-ups to employees if they had an accidental exposure. And employers must provide education and safety training for employees at time of hire and then annually thereafter. So when you get a job in healthcare setting, you will go through all of this training, and then you will do it again every year after that. And these requirements are in place to make the workplace safe for all, not just you, but also the patients and the visitors and anyone else that could come into the walls of your facility. This also states that employers must provide additional training and education and containment policies for HIV and hepatitis B research labs. All biohazardous material must be properly labeled and disposed of in inappropriate containers. And employers must provide a written schedule for cleaning, including a procedure for how to clean blood and other potentially infectious materials, and what to use to clean it up. These employers also must have a record on occupational exposures and employee training sessions as well. Isolation control measures. So isolation control measures is to help separate an infectious source from susceptible host. So an isolation control measure can help protect employees and visitors and other patients, or it can protect the patient from infectious agents carried by employees or visitors. So this could be if the patient has something that's infectious, they may have a sign or something on their door letting visitors and healthcare staff know that they need to use some certain precautions. Or it could be the opposite, where the patient is actually immunocompromised, where they have, going through cancer treatment or something. And we need to be extremely careful with those patients and not bring something to them. So there may be certain protocols in place for either of those cases. Isolation precautions tier 1. So tier 1 includes precautions that is going to be used for all patients in the hospital, and it doesn't matter what their diagnosis or infectious status is. So this is basically just going to be your standard precautions, and that's used for tier 1. So remember, wearing your gloves, things like that. Tier 2 isolation precautions. So this will include transmission-based precautions, which are used for patients known to be, or we are suspecting them to be infected with a transmissible pathogen. The transmission-based precautions can begin with standard precautions, and then it will add additional precautions based on, what they have or what they're suspected of having. So certain examples would be MRSA, which is methicillin-resistant Staphylococcus aureus, or VRE, which is vancomycin-resistant Enterococcus. So these are resistant to antibiotics, so we don't really want them getting out if at all possible. Airborne precautions. So precautions used for patients known or suspected to have a disease transmitted by airborne droplet nucleoli. Airborne precautions include having the patient in a room with special air handling and ventilation. So examples of this would be measles, varicella, and tuberculosis. People entering this room must perform hand hygiene, and they have to wear a special mask called an N95 respirator. And then we have droplet precautions. These precautions are used for patients known or suspected of having a disease that can be transmitted by large infectious droplets that can be deposited on conjunctivae or mucous membranes. Droplet precautions include wearing a mask within 3 feet of the patient. So an examples of this type of disease would be meningitis, whooping cough, and pneumonia. Contact precautions, so precautions used for patients known or suspected of having a disease that can be transmitted by direct contact or by contact with items in the patient's room. Airborne precautions include performing hand hygiene and wearing gloves and a gown. Sorry, that should say contact precautions. Examples of this disease are hepatitis A, respiratory syncytial virus or RSV, scabies, impetigo, and herpes simplex. To clean up a spill, if that does happen, you are going to wear gloves. You can use 10% bleach as a disinfection. Clean up visible blood, then you're going to disinfect the entire area. So this is for cleaning up blood, not a chemical. Make sure you allow the bleach to remain in contact with a contaminated area for 20 to 30 minutes. This just helps to make sure that everything is killed, essentially. Careful and thorough cleanup protects you and your coworkers from exposure to infectious agents and potential infectious.